engagement, support, and advocacy. I'm the president of the Partnership to End Addiction, and I'm grateful to live another day in recovery from heroin addiction and to be with you all on this journey. Thank you to Ryan, Greg, and the entire Mobilize team. Thank you to everyone for your relentless drive to advocate and improve recovery support services and amplify diverse recovery voices. This panel is on how we can use technology to enhance recovery support, advocacy, and empowerment. Over the last year, we've seen an unprecedented shift towards the widespread use of technology to support recovery, leverage existing networks to support individuals, while traditional care has been largely paralyzed. Today, we'll discuss the role of technology in engaging individuals and families in the recovery journey, the strengths and weaknesses of digital mediated recovery support, hybrid models of recovery support, and the role of technology in recovery advocacy. Briefly about me, I'm an implementation scientist. I'm a prospector, a clinical researcher. I'm a peer and hopefully a positive disruptor in helping people live free from addiction. At the partnership, I work with the team to empower family members, whatever one considers family, to help their loved ones and themselves make changes towards well-being. We do this through advocacy, policy, research, and technical assistance for providers, media to change culture, and direct services from prevention to recovery. From one-on-one text messaging and phone support with specialist peers who've lost a loved one or have a loved one in recovery, to our immediate personalized feedback based on an assessment, to ongoing text messaging for as long as someone wants, to e-learning courses for parents and families, to online support groups for those who are struggling. We know technology can increase access to those who are scared, but also curate through personalized handholding over the course of the journey. So today we have a distinguished panel of individuals who are researching, building, disseminating, implementing, and disrupting recovery services and building empowered movements using technology. We have chosen an interdisciplinary panel to get diverse perspectives on this important topic. So right now I've asked each of them to give a brief introduction to themselves and the work they do. Let's start with Brenda. Brenda.
Hi, everyone. Brenda Curtis. I'm a clinical researcher at the National Institute on Drug Abuse. I'm in the intramural research program. The intramural research program, we're not the funding part. We have our own labs and we do our own research. And I'm chief of the Technology and Translational Research Unit. My work mainly focuses on leveraging big data, using smartphone sensors, technology, online digital data in order to inform treatment, but mainly to really focus on long-term recovery. And so that's what I do. So I'm kind of like a big data person.
Thanks so much, Brenda. And you know, I think Brenda is being modest in her work. She's an innovator and disruptor. She's looking at creating equal access to care for everyone who needs it. And I highly encourage you to read her research and all of her work.
I mean, that's the reason that I got into this. I saw as a young person, a child, and moving to it, that technology was to me a way to really bridge the divide, is a way to get access to people no matter where they're at. If all they need is a smartphone and we can deliver quality treatment to them. So yes, that's why I'm in this.
Ray. Oh, Ray, you're on.
Hi, everybody. I know. Sorry about that. Hi, everybody. My name is Ray Brescia. I am at present a law professor at Albany Law School in New York. And prior to joining the faculty there in 2007, I was a lawyer, nonprofit lawyer in legal services offices, mostly in New York City and primarily at the Urban Justice Center. My research now involves and looks at, to a certain extent, the role that technology can play in advocacy and community organizing, and some of the threats that sort of lurk very much both in the background and the foreground of using that technology. And then in my former career as an active lawyer, I represented low-income communities, communities of color, in housing rights and civil rights work, including helping to serve on the legal team that brought a lawsuit against the city of New York on the way in which it was discharging people with psychiatric disabilities from the Rikers Island jail, many of whom were in recovery, in different stages of recovery, and trying to make sure that they had essential services upon their discharge from the jail. And for many of them, the only time they ever got services was when they were in the jail. So it was in many ways one of the largest sites for recovery in the state of New York. So, the reason I was invited to be here is because of my research, historical research on the ways that different social movements over the course of American history have leveraged technology to advance social change. And so I hope to talk a little bit about that today. And I'm really, really honored to be here with all of you.
I also want to give Ray a little plug. He literally wrote the book called The Future of Change, How Technology Shapes Social Revolutions. Literally, it is a beautiful read. In how he goes in depth to understand the nuance of what it means, and then think about these universal mechanisms from 1,000 years ago to today. It's an invaluable read for all of us who are trying to change the tide here. David?
Thank you so much, Ray.
Hey guys, how are you? My name is David Sarabia. Can you hear me okay? Hey, this is David Sarabia. Thanks again for having me, Fred. Ray, big fan of your book. I think it's an excellent book. I've read it twice. And Brenda, really super honored to be with such a panel. I was actually at Rikers during my active addiction, so I ended up there for a couple of days. Actually, it was an interesting situation. Anyway, my background, not someone that you would imagine being at Rikers at any point in his life. I'm a tech nerd. I started coding when I was about 8 years old. Founder of In Recovery now. So I ended up selling 2 companies very early on in my life, made tremendous amount of money, moved to New York, became a huge drug addict. And that quickly elevated to heroin and everything I can get my hands on. Ended up homeless on my 30th birthday, taking the A train, if you guys know New York well. It's the longest ride from Rockaway all the way uptown, solid hour and a half of sleep. Got back on my feet very quickly, thank God, and ended up just being a functional cocaine addict for many, many years until my best friend passed away in 2016. And that led me to rehab. And when I went to treatment, I found that our clinicians were tremendously invested in us. They really cared about us, but they were flying blind. So they were working on clunky EMRs, systems that were just in the way more than anything else. There was no insight at all into how a patient was actually doing. And I built In Recovery. When I was there, I realized I was there for more than just my own treatment. I could actually help people finally with my skill set. And I founded In Recovery because of that. And In Recovery, in a nutshell, is a framework that helps treatment providers really leverage patient data, understand patients at a deeper level, and really carry people through the continuum of care from both pre-treatment to actual inpatient and aftercare. And really happy to be here. And thanks so much for having me, Fred.
David, thanks so much. And, there's a lot of startups out there. And I've spoken with a lot of people, and there's just amazing people in the field. Thought it was so important to have someone representing the startup community who are out there, in addition to the nonprofit research and advocacy communities. So thank you for being here, David. And so I'm going to shift gears a little bit, and I'm going to just jump into a presentation just to do some level setting. In terms of what we're here going to be talking about. It'll just be a couple minutes. So this is the name of our panel. This is our wonderful set of panelists. And so I think, this is silly to just say, but I think it's important to say that technology is a tool, and it's been a tool forever. The wheel is technology. And most important is technology shifts how we communicate. It shifts what we do, how we learn, what we do. It allows humans to interact on a global level. And one of the important things is tools create new tools. But we do have to use them the right way. And this is why this panel is here, to think about how we can use these tools the right way, and be mindful of their power and downside. So there's tons of technology applications. Not going to go into this, at some point, I think we're all aware of the power of these different mediums and the features of what they can actually do, from telehealth to reach, to thinking about environmental monitoring, to understanding geolocation, to proximity sensors. Like there are amazing opportunities we have right now to leverage these features and tools, but that's what they are. They're tools, and remembering what is the pro, what is the con, how do we use X tool for X problem, going in it from a barrier perspective, thinking about the barrier, the opportunity, and then what's the tool rather than the tool and then the barrier. And so technology has good and bad. Hands down, we look at access and reach, right? This has shifted everything. Disclosure is also another one. We know that people disclose more to technology-based systems than to humans. This is this is 50 years of research. It can make something salient on the mobile phone, as Brenda spoke about. We use analytics to predict. That creates personalization. That creates adaptation, and that creates just-in-time interventions. That creates just-in-time movements that we can all get together and move together simultaneously in the moment. So there's amazing opportunity in the recovery space. There's also concerns. We think about dehumanization. There is distance here. As we're looking to chatbots, the pros, the cons, and there's a lot of pros. But at what point do we have to shift to human? When do we create these hybrid models? Are we relying on the technology? Are there going to be technology failures? Is there information overload to people? Is there messy, unreliable data as we're trying to look? And our algorithms can be wrong. We've seen this over and over with Google and Facebook. We have to be mindful of that. Most important, and I think a little bit of what we'll probably discuss today, just as reach is probably and access is probably the number one on the good side, well, privacy and security is on the downside. And particularly, I always talk about this as maintenance. Things change so fast. So we have to be mindful of what that means, how things change, and how we connect people over time. This is no surprise, but just giving you all an idea of the massive shift in telehealth use since the beginning of COVID. This was a McKinsey report, and there's a 38 times increase in the use of telehealth services since the beginning of COVID. It reached 80% at the peak, and now it's leveled off. But it varies by discipline. It varies. So what we see is a real difference in who's using what by discipline. Look at the top two. So technology is driving psychiatry and telehealth, psychiatry and SUD treatment. That's a big shift. That's a huge shift for the work we do as clinicians, as advocates, as supporters, as peers, and we have to recognize those opportunities. And so one of the things that's happened is the online recovery support groups and system has exploded. So is online advocacy, as we saw across with Black Lives Matter movement. Online, a lot happened. So when we think about these new groups, Unity Recovery, We Connect, they're doing amazing online groups. That didn't exist before the pandemic, or there was a little bit, but it really didn't exist. Now there's tons of groups. In the Rooms has been around forever. It's exploded after COVID. The tech companies have gotten together to start recovery, to get tech together for recovery. It's Twitter, Facebook, Google, who are curating resources for people because they know there's online support. And shameless plug for us at the partnership, we're doing online support groups for parents and families. So this panel is really designed to have a discussion about this. It's designed to say, hey, how do we think about this? What are the pros? What are the cons? How can we leverage? What are hybrid models? What is all this? And I'd love to start the discussion with all of you by starting with, where's the opportunity? What do you see individually in your own worlds coming from these different perspectives as the opportunity to leverage technology to support recovery and recovery advocacy? Brenda, I'm going to start with you based on your years and years of experience researching this from multiple perspectives.
I think that you kind of touched upon a lot of it, dealing with the access, being able to move and to be able to quickly innovate and get services to people. I think that before COVID hit, we had a lot of barriers in the way of getting access for treatment. A lot of states had constraints set up around telehealth and all, and services like that, as well as I think that there wasn't enough positive parts put on peer-to-peer recovery and the importance of that. And I think with COVID and with what's been happening and the shift in technology, we've seen that you can use these digital tools in order to deliver quality care to people and to reach people, as well as the importance of using peer-to-peer support service to fill in those gaps between the quote unquote therapeutic interventions that's happening between therapists and counselors and patients. I'm used to saying participants from research, I'm sorry, and patients. So I think that we were able to quickly move people to these online platforms in order to kind of address the constraints that we had.
And Brenda, you bring up something very important, which is the rise of the individual in recovery and the peer-to-peer movement as something that was a positive, an opportunity from this that was largely left as grassroots or separate or something different. Can you talk a little bit more about that?
Yeah, this was like one of those moments where your heart, like you get tears in your eyes because you're just so excited of having lots of colleagues and friends in peer online recovery support groups who, soon as COVID hit, are sending me messages and DMing me saying, oh my God, my online group that I typically have of 20, 30 people, I had 100 people on to this week. And then them rising to the occasion before, SAMHSA released rulings of like, okay, it's okay to do telehealth, of them taking on the community and of this group of people who needed support during a time of complete isolation. We lower services of harm reduction was going on in the community, where peer-to-peer support services really jumped in to fill that gap. And I think that we saw, a group that maybe people have marginalized and thought of as, just grassroots, but they were substantially, pushing and being the ones who really helped during COVID-19.
Thanks so much, Brenda. And it leads us to a little bit of the empowerment discussion, maybe a little earlier than I was even thinking, but it's so important. And I'm wondering, Ray, in looking at the people who are making the change, it doesn't come from existing structures, right, in terms of what this is. And I'd love to hear a little bit about your thoughts on these grassroots movements and how it focuses on advocacy and thinking about that.
Well, I think that any effective advocacy effort is often, I believe, built on empathy and connection, and having people connect with others and to see others as being, both like them and as sort of sharing together a destiny, a shared destiny, that together folks see, a better world tomorrow through seeing the humanity in others, seeing allies across difference. And I think that one or potential difference, and then that through building connections and having interactions with others, you start to see that shared destiny together. And I think that over the course of American history, typically that empathy was built in face-to-face encounters, and that we had more opportunities for people from the same community to work together towards a shared goal. And there was, less siloing, fewer, to use a metaphor, really, we didn't live in gated communities, and that the person who, owned the bank, would walk down the street and be, rub elbows quite literally with the person who drove the stagecoach. And so it sounds sort of quaint to think that way, but that really was American society in a lot of ways. There was a lot of difference. There was a lot of discrimination in many communities. There was obviously, we had issues of slavery. We had, terrible ways in which divisions were created in society. But we also had a very different society where lots of people, lived in the same community and had to work together to achieve shared goals. I think that in the sort of early 1970s is a point where a lot of those traditional connections broke down. Ironically, right at the time when the civil rights movement was sort of at its apex and achieving some of its greatest victories, it also was a time that we started to retreat into corners, and technology enabled that. You think of whether it was television, or I trace some of that to the emergence of sort of almost quaintly again the ability to engage in advocacy through computerized mailing lists. And if folks were able to watch the really brilliant show on Hulu about the women's rights movement and how the conservative movement emerged, if you would, based on computerized mailing lists in many ways. And so we retreated into our corners, and I think our society became less equal, less connected, less empathetic in many ways, because we didn't have those spaces where people could communicate. The union hall, I'm a former tenant organizer, the building lobby. I think we're getting some of that back, not necessarily the face-to-face component, but here we are, being a little, we can see each other's faces, we can see and build connection with each other. And I think we're getting some of that back, and we're seeing some of that advocacy. And one of the movements that I trace is the movement for marriage equality, and how that really built on, some face-to-face encounters, lowering stigma, working in local communities to build change from the grassroots up. And I think we are very much, if you sort of trace the emergence of that movement to the sort of early 1990s, when people were starting to come out to friends and family members and do things like attack criminal laws that criminalized sexual acts, and sort of try and find those to be unconstitutional, as they did successfully in the 2000s, and then build towards a positive right of marriage equality. I think you can see a trajectory that might be helpful to the recovery community to think about targeting the criminalization of addiction. And that's a place where I think that there are opportunities for shared interests and seeing common destinies. And we see things like decriminalizing marijuana possession, and from the civil rights perspective, right, the disparate impact that has on communities of color, and then seeing a convergence of interests between the recovery community and the civil rights activists. So I think that there are other opportunities, and I went on a lot, and I want to allow others to jump in here, but I think that we're sort of at the precipice of some opportunities here, and I'm sure we're going to talk more about some of those opportunities, but I'll be quiet now, let others jump in.
David, thank you so. Ray, thank you so much. I think you've touched on so many topics there that are very relevant to the recovery community, as you mentioned, in terms of reducing stigma, changing language, criminalization of substance use disorders, and what that means. And what struck me is a few things. One is that what it means not only to the individual and our community, but what it means to the larger society, how we think about this from a larger societal perspective. And I'd like to ask David, as a developer, as a coder, who's someone who's been in the technology field for many, many years, both in developing tools for those in recovery, but before, Ray, you brought up something about empathetic systems, right? This is empathy, this is rubbing elbows. And I'm wondering, David, if you can give it like some thoughts on how we build empathetic systems, how we use technology to foster empathy in this world where we are deeply personalized. There is a difference. When you do something anonymously, yes, you'll disclose more, but you'll also be we'll all be awful people, because there's no judgment, there's no, no accountability. Wondering if you can chat about that a little bit, how you see building empathetic systems and how that fits into the recovery movement.
Fred, Ray, first of all, that was great. I think that you touched on one point that I always make, and why I always will love New York and it'll always be home. Yeah, I love the fact that you ride the subway, you ride the metro, and you're rubbing shoulders. You have a homeless person sitting next to a billionaire banker and a middle-class person, and that's why New York is so special. And I think we can learn a lot from that. And as you were saying, Ray, I think one of the biggest barriers really beyond technology is the social stigma for recovery, for long-term sustained recovery. And when it comes to empathetic tech, it really takes understanding the problem. And I think that ultimately, Fred, for that to happen, and we've discussed this so many times in the past, is people need to have on staff both developers and software engineers, product people, everything from even customer support, people that actually truly understand what it's like to live with a mental health issue or with a substance use disorder. Otherwise, it's never going to happen. And we all look for and we all hire Ivy League people, Harvard, MIT grads, Stanford grads, and many times there's a big disconnect. So when I look at companies and companies addressing addiction tech, let's say, you can tell when it's founded by someone that has actually lived it, because of the level of care and detail that goes into it, and specifically the amount of thought that goes into meeting the person where they're at. And I think that that's going to be ultimately where I see a huge opportunity for us in technology. And thankfully, quote unquote, COVID opened up many opportunities for healthcare technology. It became a necessity over a luxury, how it was before. And I think that now we have a unique opportunity to leverage that continued movement, but also to Ray's point, let's start learning and really seeing how we can adopt the past situations, like let's say the AIDS epidemic back in the 90s, and how we can learn from those movements and how they leverage, let's say, communication, and how we can now push it forward in this age where now we're so connected. And I think that it is a double-edged sword, like you said, Fred. I mean, we are all so connected, but we're also so isolated. And without connection, there really is no recovery. So ultimately, I think it's going to be twofold: having highly diverse teams in these tech companies, and beyond that, really learning from the past, I think, and how can we adapt things that maybe were not in mental health, maybe not in the substance disorder space, but could come into this for the same use cases of, let's say, social reintegration, of destigmatization and decriminalization of the issues.
Thanks, David. It brings up some of the work that you're doing, Brenda. And when we think about the most disenfranchised populations, those who have been left out of the system, those who don't have access to care, whether that's through systemic racism, whether that's through poverty, whether that's through, having a specific disease or condition that's stigmatized. I wonder if you can chat a little bit about what David is saying, and expand in terms of what do you see as the opportunity here? Well, particularly with tech and the strengths and limitations of it in that.
So coming from starting a lot of my work, I was always like doing HIV and substance use work at the same time. I initially started working in a drug treatment center in my hometown, working with women who were HIV positive, contracted through a substance use disorder. And so, kind of that merger of being able to gain from that. But also one of the things I realized is everyone has a unique story. Pulling from the HIV field was the idea of kind of, as a researcher, always having a community advisory board, always having a group that as you are making any piece of the research or any piece of a tech, any piece of a brochure, anything, that you have representation at the table of equal power of the people that you are trying to reach, of coming in humble, understanding that they're the ones with the knowledge and the experience. So, one of the things that I've always working with in underserved populations, and you're underserved because typically of historic racism and segregation, but also the stigmatizing of a health condition that you stigmatize and criminalize of every part of it. So being able to do that, but also at the time realizing that the people of the community and these communities and my community need to have a voice at the table, and an equal voice at the table, is more important also to understand that they can be developers. They use technology more so than most of us, and thus they know what features and things that they want, so they can help in that. They also provide us with a force to make sure that we are addressing them. We also can use technology specifically to personalize and tailor content to people. I consider myself a little bit big brothery, and working for the government does not make this sound any better. But a lot of the things I do is we put tracking with consent, tracking software on your phone with consent. You know exactly what we're tracking. You can opt out at any time. We collect social media language. One of the things, for example, with social media language and project that I've worked on and I'm still working on and building out, is we can collect social media language before entering treatment to be able to predict out extremely well the likelihood of dropping out of treatment in 90 days. Why is that important? Is because if I know at day one you're at high risk, I can wrap around peer support, lots of services to that person, because that person really needs some extra hand-holding. And so being able to use technology in order to, as David said, meet people where they are. As Ray is saying, being able to integrate what we know into treatment, and being able to do it ethically and responsibly and built off of people, so we want our algorithms to not be biased. We want to make sure that we got data from the people we're serving. So I threw a lot in there, but long short is that we can use technology to personalize treatment to people where they are inexpensively, so that underserved, highly marginalized, highly stigmatized populations can get the same access as a billionaire would.
Brenda, thanks so much. I mean, this hyper-personalization, right? This model of prediction and the opportunity it is massive. At the partnership, we have people fill out an assessment, they get personalized feedback, and then ongoing, text messaging, because it's available to everyone, right? There are certain things we're doing. And shifting to David, as someone who's building these personalized models, can you talk a little bit about how you're doing this, and the what's working? What do you see as some of the opportunities and some of the drawbacks?
Yeah, Brenda, we definitely have to work together. I love what you were just saying, and don't get me started on AI bias. That's a whole topic for a whole panel. We're doing some great stuff.
David,
yeah. We should have that. That would be amazing. And I'd love to bring someone in from MIT that I was working with during the COVID-19 challenges that we're hosting. We operationalized or helped operationalize a series of events and hackathons, global hackathons around COVID-19. That's a whole different topic. But one of the events that I led was focused around racism in healthcare. And not to go too far into a segue, I'll circle it back in. One of the groups that won one of the tracks was a bias detection for AI. So looking at actually having bias detection built into the software, which is just brilliant. But anyway, going back to what you were saying about this opportunity, let's say like the social media language, Brenda, I think that that's a massive place where it's just ripe for innovation. When it comes to coming to treatment, having been there myself, when I came to treatment, first of all, I didn't want to be there, even though I checked myself in. And second of all, it was nerve-wracking because I had no idea what was going to happen. And really, for a patient or for a person, when they're coming in, you start opening up towards like the second or third week, and by then you're almost done. And there's such an opportunity on the pre-treatment side, or even just in the intake side, like you said, Brendan. We're seeing this a lot even with our own clients, and one of the biggest things that's just so great, we've been preaching to the choir about the power of peer support, and even peer support at the treatment centers. And thankfully, our clients, one and notably Karen Treatment Center, has been quite open to that. And that's really great that they have actually started implementing peer support in traditionally just clinical programs. And we've enabled that, which is just really, really exciting. And we're seeing that people that go through a peer-led, or not peer-led, but peer-enhanced program or process have tremendously better beyond outcomes experience and connection with other people, and really just that life safety net that you need for long-term recovery.
Thank you, David. As I think about, you're both brought in peers. You both brought in sort of the movement of ensuring that it's accounting for personal differences, accounting for all of these individuals who are different. And I'm wondering, Ray, specifically with a movement like the recovery movement, you're bringing together a diverse group of people across different races, ethnicities, socioeconomic status, and you're trying to create a movement among all of them. And as you mentioned Me Too, or the women's movement, in terms of that being able to do that. How do you see that, bring diverse perspectives to make voices louder? How do you see that working?
Well, it can be challenging, of course. And I do think that there are, you can have some loud voices in the room already that can drown out, and that have historically drowned out the voices of people from whom we most need to hear. So I think that it requires a great degree of humility, a willingness to listen to others, a willingness to create space for people to meet people where they're at, and to ensure that you draw people out. And it might take a few sessions, it might take months, it might take years. And so you might have people who have a long history of advocacy and of sort of presenting themselves as someone in recovery, and then others who've never come forward in that way and self-identified in that way to themselves and to others. And so we need to create spaces where it's safe to do that. And I think that those peer-to-peer spaces are some of the most important and most powerful. And then when you bring in advocates from the outside, where you've got your group, and it could be small, it could be 2 or 3 people, and then you link to a broader group, or that broader group then brings in outside advocates like lawyers or elected officials. Make sure that you are working with people who are sensitive to the needs of the group, won't silence the members of the group who maybe need a little time to warm up. Work with advocates who are sensitive to their proper place in the advocacy. And there's my experience as a former community organizer, as a lawyer for community organizing groups. My role was to be on tap and not to be on top. That to take my lead from the organic leadership, from the individuals who came up through those groups, those enclaves, those networks, and to support the efforts of the group and not to put myself in the role of having a leadership role. So when that group connects to advocates, elected officials, make sure that you're working with those people who will put the organic leadership and the members front and center, because those are the voices that we need to hear from, and those are the voices that are going to build that empathy with the broader community and build those connections to the broader community. And I think we have a really, in this space, we have an incredible opportunity now with a growing awareness of opioid addiction and the extent to which that reaches quite literally into every community, urban, rural, rich, poor, white, communities of color. I mean, it's really touching every community. And I think we need to build bridges into every community as a result of that. And so I think there's a real opportunity now, and you're starting to see groups across the political perspective and across the political spectrum sort of recognizing that there's an issue here that we need to all address together.
Shifting gears a little based on something you're talking about, Ray, you're talking about sort of this persistence, this bringing groups together and moving forward and thinking about the larger mission, the larger goal of what it is, of whether it's political, whether it's individual, it's family members. I know, we've been advocates of families as advocates. They have not traditionally been part of the recovery movement, right? And there's a lot of family members who want to be a part of it. What we've seen more often than not, particularly among people who've lost want to make a difference. They want to think about it, and they're in it. And as I think about all of these different individuals, the other thing that strikes me is the sort of the journey part of this, is that people, this is a little different. It doesn't end all the time when you're in recovery, right? You're in recovery, you're thinking about it, whatever it is, your family member, if you've lost, you're thinking about this. And I'm wondering how we can use technology to sustain the recovery, whether it's from a movement perspective, the recovery perspective. How do you see the maintenance? This is not a one and done, right? This is something bigger. And how do you maintain, whether it's individuals in recovery, and I'd love to hear, about some of the research of like longer term recovery networks and all of that you've done, Brenda, and David, like, keep people in apps, right? Objective engagement in the support system, whether it's a grassroots movement, a for-profit app, whatever that might be, and then Ray specifically for advocacy. Anybody want to jump in?
I'll jump right into that one if you don't mind, Fred. And really just to kind of continue with what you just said there, the opportunity again for these grassroots movements and really for society to start understanding that people need a second chance, that technology and innovation are only halfway. When you come back to from addiction or from active addiction, you have to reintegrate, and that's very difficult, especially when you're consistently labeled as, say, an addict, and you're consistently, or maybe you have messed up in the past, maybe you have a criminal record, and it's impossible for some people. I personally go to 12-step meetings all the time, and I see people that are 20, 30 years in recovery, and they can't get a normal job because they messed up, and that's not fair. So I see a huge opportunity on the journey side of potentially providing supplements or supplemental systems to the traditional credit system or traditional background system, let's say, to actually potentially take a report and say, here's what I do, and here's what I've done in the past 5 years. Here's why I have a gap in my employment. So I actually have a real second chance. I think that's where technology can really make a massive impact beyond the AI and the chatbots and all that. When we come back down to the human need, that's where I really see it having a huge impact in a person's journey and long-term recovery.
One of the areas I'm hoping that we move to I do a lot of work on stigmatization and decriminalizing and kind of this idea, of how, I look at it empirically, like how much do our horrible system prevent people from getting treatment and staying in treatment and, fulfilling their recovery path. All of this is measurable. Like this is not just people's feelings being hurt when you use a slur of calling them a crackhead or grabbing your purse when someone walks in the room. I mean, we don't hire people. We have policies and laws which discriminate against people based upon a medical condition. That has to change. Like we cannot continue to allow this. And as a community, we need to look at some of our some other countries and start making some very progressive. Or actually, it's not even progressive. This is downright just not discriminating against people. Like this is basic. Like saying you should not do this to anyone. And so I think we really need to, as a group and as a health, as academics, and I actually just gave a presentation to journal editors in addiction journals, and we talked about language, we talked about structural racism and how to kind of, all of that. So I think timing is perfect, but I think we need to, as you said, we need to move the field. We need to move people into understanding that it is not okay to discriminate against someone because of a medical condition ever.
And Brenda, where do you see the role of technology in that? Where do you what is the opportunity that we have in supporting recovery networks and individuals who have been largely left out because of stigma and structural racism and barriers? What do you see? What do you see as the opportunity?
Well, for me, my mindset, one of the things I would like to do is work with, or I see a room for technology, is strengthening the patient and family role. When I've talked to a lot of family members, areas that they've said to me that they would like to see technology is they know how harmful it is to ask someone in recovery, how are you doing every day? And checking up on them and looking at their phone and seeing where they've been. They know how harmful that is. And it's very intrusive, and it's saying, I don't trust you. And, that's just not good for any relationship. One of the things I've heard from families is that if they had an app that just gave them a check-in saying, thumbs up today, green, yellow, red, they would be able to not have to kind of do that intrusive checking that they feel like they have to do, where they could feel comfortable with this app. I've had people in recovery say to me, like, I thought that, we had this one feature that we could turn the phone back on if they turned it off. And I was like, oh my God, that's so intrusive. And I've had people say, no, I'd like to have that option. If I haven't checked in 3 days and my phone is off, I would love for you to find where that phone is and send it to a person I've designated that you send that information to. So again, personalizing treatment, letting people decide how their data is used, who has access to it, and where it can go, and really figuring out ways to give families and support of others, along with the person in recovery, of course, access, consent and all that, making tools that really help them. My idea is that just because a person, quote unquote, has a lapse, we can use technology to make that just a lapse and not something that, has become life altering or something on their record that then they can't get out. So I would work on those things. But I also work on policy.
If I can jump in here, I think that what is sort of really at the core of a lot of social change work, and it is, it may sound strange to say, but it is self-interest. Now, I'm going to go back 200 years to Alexis de Tocqueville, who was a French aristocrat who visited the early United States, and he saw how he came to see how democracy works. And he said, what seems to make things work was self-interest rightly understood. So not just pure self-interest, but self-interest rightly understood. And I think that what what Brenda was talking about, what David was talking about, with the technology, we can sort of bring different communities together and ask them about, together, sort of, what are your interests here? How can we look at the different interests that people have, and how do they come together? How do they dovetail? What is it that the family member needs, and what is it that the person in recovery needs, and how do those interests overlap, and how can we tap into that overlapping of interests, and whether it's what we need from the app and from both sides, if you would. But that's just good user experience and user design. But getting people in the room and using, quite frankly, using a process known as design thinking, where you talk to the end users of the product, which could be a physical product or it could be a social movement, and said, where do our interests converge? And I look to, in recent memory, the movement for felon reenfranchisement in Florida. And one of the things that the advocates for that, who were very successful when they took their effort to the people, and there was a referendum that passed overwhelmingly, and then the legislature scaled it back, really in a horrific fashion, really in a counter-democratic fashion. But what the advocates did to get to that point, they said, look, even if you are, if you're not a felon, and most Floridians are not, but if you're not a felon, you still want felons who are coming back into the community to feel connected to the community, to feel engaged with the community. And one of the the most critical way that people feel engaged in a democracy is that they're able to vote, right? And so the broader community had a real stake. And this is what the advocate said: you have a real stake in us, those of us who are returning to the community as felons who have served our time. You have a real stake in us feeling engaged in the life of the community. And I think that sort of idea of, okay, what is it that we all need from in these spaces, and from tech to aid recovery, and having frank conversations with people about what their interests are, what their needs, and how those interests and needs can come together. And I think, David, you'll say that just sounds like good user design, and
right.
User experience design. And I think it is. And again, whether it's a social movement and the messages that social movement embraces, or it's tech, as you opened up this conversation, Fred, Brad Smith from Microsoft says, technology can be a tool, it can also be a weapon. And you think of, a hammer, it can be a tool, it can be a weapon. Tech can be a tool, it can be a weapon. And so we need to make sure we are using tech as a tool and not as a weapon.
Thank you, Ray, and thank you to everyone for highlighting something. The first thing I want to talk about is just in terms of a summary is we're talking about global issues here, right? We're talking about the issue and then tech, and again, going back to that importance of the tool you're saying, it can be a tool or a weapon, and how important that is, and that everyone benefits from people recovering. Everyone benefits from it. Everyone benefits from this, and making that very clear. And you bring up, just very briefly, you would love to hear a little bit about some of the concerns here of tech specifically. We brought it up a little bit, but I would like to highlight, as there's a lot of hype. We're seeing this over and over. Oh, tech can do this, tech can do that, tech. But briefly, can you dive in a little bit about one or two concerns you have that we should be mindful of as we move forward, because we're moving forward. This is not this. It's not like, okay, that was fun. So a couple of concerns. Anyone?
No. Well,
Go for it, please.
So this, as David has said before, this right here could be its own panel. We do have still some access issues, disparities. And it's not like the old school access of do you have a cell phone or not. It's kind of more like, do you have high-speed internet connection? So if you're building tools that require high-speed internet connection and people having certain unlimited data plans, you should be aware. So there still is kind of a disparity there. There's also a information disparity where some people know where to get information and other disadvantaged, to be traditionally disadvantaged or marginalized populations don't know where to get that information. There's privacy, which goes both ways. We have privacy on the digital platforms and also privacy of the fingerprints that we leave behind, and the point that other people, which are outside, let's say if you're using an app or a tool or a social media platform, but even people on those platforms, but people outside the platforms can track what you're doing. Again, this goes back, as long as substance use is criminalized, you thus are leaving a criminal fingerprint of behavior, as well as something that can be used against you. One fear that I have is that, like, tools that I build, for example, like the tool we talked about of being able to predict the likelihood that a person's going to drop out of treatment, that could also get into the wrong hands. And there's, we can all think of how that can be used. So yes, so disparity, privacy, and then there's also like tech issues, just kind of like access to, being able to use certain things. I'll stop. Oh, social isolation. That's it.
Thanks, Brenda. Others? Concerns?
Go ahead, David. I do think privacy is a huge issue, and that sort of false sense of security that people might feel, and it's once bitten, twice shy, right? Like if someone engages in this, shows their vulnerability, shows information to others about their recovery journey, and then that's exposed, that's going to not only affect that person, but it's going to affect the whole community. That this is, here are the risks here. And Brenda, you sort of talked about that. I do think that that privacy is such an important issue. And then another one is the use of AI and to profile people and to particularly we're talking about garbage in, garbage out, right? If there's data, if you've got policing that is overzealous and discriminatory and aggressive in communities of color, and then that leads to disparate arrests and criminal records for possession that impacts young men of color disproportionately, and then that gets fed into your algorithm for determining recidivism and criminal propensity, or whatever you want to say, it's going to have a disparate impact on those individuals, and it's going to stay with them. So it's sort of mutually reinforcing, as I said, the sort of garbage in, garbage out. If we've got discriminatory, if discriminatory patterns are then baked into our algorithms, that's going to then perpetuate that discrimination and that stigma even more. So that so there are real risks, really tremendous and really damaging risks of it that are likely and are happening now with these sorts of algorithms.
Yeah, I would add to that it's very important that we look at what it means to someone in recovery to actually give back. So to your point earlier, Fred, of giving people the opportunity to come back to the community and to actually be able to lead or influence others that are now, let's say, fresh in the recovery as well. This is such an empowering feeling. I know for myself in recovery, helping others has been one of my pillars, and it really has helped me get out of my own head and really stay in long-term recovery. I think it's almost 5 years now or something like that. I lost count, Fred. But giving people that platform or that opportunity, I think, is going to be key. And when we're talking about marginalized communities or really by design. Unfortunately, it's not that they're underserved. They're just they've kind of been set up that way, unfortunately. But we can really level the playing field at that point and really enable true access, not just to care, but to quality care, to quality recovery, let's say, or things that can actually help someone truly get back on their feet. So I really, that's such a huge opportunity. The data privacy side, obviously, that's always a massive double-edged sword, right? There's so much you can do with data, but it's also, like you said, Brenda, in the wrong hands, it's just, it can be quite nerve-wracking. But I really think that people that are in the recovery community, that are in recovery themselves, they want to give back. They want to be part of movements. I think there's a big opportunity to, use anonymized data for research, to really be able to empower them to give back potentially their data, anonymized, stripped from their identity, to really then move things forward. Like you said, Fred, there's no stopping anymore. And how can we move forward in an ethical way? It's I hope that other tech startup founders are in line with that, but unfortunately, not everybody is.
As we talk about the concerns, privacy certainly comes up as just paramount in terms of what we're doing, and that privacy in terms of data, whether it's an insurance company getting that, whatever that might be, is scary. And that's coupled with, if we're asking people to speak about recovery, that vulnerability, Ray, you all mentioned this vulnerability of putting yourself out there. There's also the impulsivity of not thinking you can throw something up on Facebook like that, then it's out there. It's out there. If you say, and then an employer, as Brenda, you're saying, we're not there yet. We haven't done this yet. We're still not there. The stigma's still there. So if you're empowered in knowing how hard it is, and knowing that relapse is often a part of the process, and knowing that employers are going to discriminate against you, and what that means to put that out there, so scary. And we do have to work with individuals so they understand those risks with technology. And I really appreciate it. One is and I'm just so grateful for all of you. I love how this panel talked much more globally about the issues we're facing, and then dove into what are the potential solutions, the opportunities, and the concerns. And I'd like to leave with this, which is, you have an essentially unlimited money supply. You have tens of billions of dollars, and you can build a product or service to enhance recovery support, and you can change a movement. Think about a movement. And you're using technology. This is you can't go and shake someone's hand, or you can maybe trigger technology to make someone go and shake someone's hand. But what is that product? What are you building? What do we do? What's the opportunity? The money's not an issue right now. Dive in however you like.
This is a really hard question for me. Like, if I had unlimited dollars, what would I build, or what would I want? For one part, I want to put some of those unlimited dollars into maintenance. We build things and then we don't have the structure to maintain it. I would love to have something that helps peer support people be better at giving support. And because one of the things is, like, it's millions of peers, and it's 10 counselors, right? But no, so you have a situation where if I can help peer specialists and peers be better at what they want to do and that they are doing, I would want to put some of my funds into a tool that does that. I'd want to have the family component. I would really want to, if I put it like this, if I shouldn't use the name. If someone can convince me to wear a certain type of boot that is not necessarily the most attractive, but I love them and I have tons of them. If they can convince me to do that, I can figure out a way to do message persuasion and help develop content to keep people on the path that they've decided they want to be on. So I would like to spend more money on being able to get that really detailed, granular information in order to come up with those types of algorithms and tools. And I'd want to build some for families and build something for peers. Okay. That's it for now.
Love it. I would actually take it a step back, I would invest that in infrastructure. I think we really need the right infrastructure to then enable all this. I think when it comes down to our unfortunate situation in the US, with there still being systemic racism in healthcare, and it's 2021. I had to look at the year, forgot for a second with 2020 being a blur. You know, when we look in contrast, like let's say Estonia, for example, I travel a lot, as you know, Fred, and we have teams overseas. Such a tremendously well-designed healthcare system, such a tremendously well-designed state in general. Everything is so, it works, it just works for people. And yeah, they pay a tremendous amount of taxes, but it's worth it because they actually are able to receive high quality services. And I think if we take a step back beyond the what we can do with technology, but what can we do with the infrastructure so that that then prevents these things from happening, that we could then empower communities to really not have to go through the things that they have to go through, unfortunately. And I think that there's a massive opportunity there. If we had unlimited amounts of funds, I would definitely start on the infrastructure play, and then get into the fun stuff with all the data opportunities. I think that we can all geek out on that one.
See, this is why you don't go first. See,
Yeah,
this is,
exactly.
you know, he like trumps me. He just goes in like.
I'm going to challenge David to then actually give another answer that has to do with technology. Like, so the fun stuff or whatever it is, we need infrastructure. We know it. So let me ask you about specific technology.
There's a dog barking. I said, of course, right when you asked me the $1 million question, literally, I'm actually talking about technology. I'm actually talking about technology infrastructure that can then enable better healthcare systems and better care delivery and better access to care so that we can start preventing. I think, sorry, this dog's not going to stop. Can you hear it? Barely. Okay, cool. I'll just keep going. So I think there's a big need for prevention. I think that, you know, we've always been in the US a healthcare system that takes care of people that are sick. If we can invest this money into prevention, into, let's say, education and potentially identifying someone before they go off the rails, you know, addiction it's a slippery slope of a hill. And you get to a point where when it's a little too late, you actually need some serious help because you've kind of gotten there. It's never too late, but at least, you know, for me personally, it took some serious help for me to get better, even though I wanted to get better. It was the first time I could actually do something that I put my mind to. And I think that getting people before that is where the big opportunity is. I really foresee us, even as a company, eventually being at the retail pharmacy level with preventative care models that can be very low cost and affordable and accessible to everyone. Because treatment is also extremely expensive. We never talked about this. It's more of a privilege than a right to go to treatment in this country. It's $30,000 a month. It's just not something that everyone has, you know, sitting in their bank. And healthcare coverage obviously takes care of that, but then your options are also not quite as good. And it's questionable whether you're covered or not, unfortunately, these days with all the rampant fraud that went on. So I think on the prevention side is where I would really focus on in terms of tech.
Thanks, David. Right.
As a former community organizer and still lawyer and law professor, my attention goes to advocacy efforts to change laws, and I think that, you know, we've got you know, really the brilliance of the American system is that you can experiment in the states, and that you can, you know, find states where the legislatures, where the governor, where the courts might be more receptive to, you know, one approach versus another, where they might be receptive, you know, generally. And we've also seen some sort of interesting instances where, you know, Medicaid expansion occurred even in quote unquote red states, because people see, as I said before, that sort of, you know, that self-interest rightly understood. So I think what I would do is I would, with unlimited funds, is that I would, you know, really look at what's working, what different models are, whether it's you know, marijuana legalization or decriminalization of possession, whether it's, you know, expanded treatment opportunities, whether it's, felon reenfranchisement. I think that that's a piece of all of this. It's, housing first strategies. What is the menu of options that we have to aid recovery in different areas? And then, some market research, some polling, some message research to find out what's going to play in what states, what's going to have traction in what states, and then move. Sort of like, on Game of Thrones, you've got the map of Westeros. Where are you going to move your cavalry to advance one effort in one state where there might be traction, and where are you going to bring in the dragons somewhere else? So you think about where change can happen, what change can happen, how change can be moved in different states, and then that eventually allows people to see that change is possible, and that after there is change, the sky doesn't fall, and actually things get better. And so you test out different things, and you see what works and where. So with lots of money, I would do the market research. I would build the grassroots networks internally, because that's how change is going to happen. And then push different ideas in different places where it might gain traction, and then you get results, and you see not only the positive things that can happen, but also that, as I said, the sky doesn't fall after different things are initiated, and then you get some data, and then you move into new communities. So that's what I would do in a national campaign that was grassroots focused, and looking at how different things, different messages, different strategies can resonate, gain traction, and gain victories in different communities.
Right. I got to jump in if you don't mind, Fred. But this reminds me of the civil rights movement, and kind of being able, I'm just imagining, imagine if Martin Luther King would have had, Snapchat, or, an app where they could really mobilize people. And I mean, not that they didn't mobilize people, I don't want to say that, but imagine if, you could have something where you could really kind of have a lot of that data, and being able to use that data in order to mobilize forces, but also share information of this worked here. Here's, the law that we wrote, or how we got this done, and being able to easily share it. So I can see an area where technology could really be instrumental in that.
Yeah, so in the book, one of the stories I recount is the effort in Maine in 2012 to pass a ballot referendum in that state. And one of the things that the marriage equality movement did is they had hundreds of thousands of door-to-door conversations with people, and they deep conversations. And then when they had a poignant story to tell, they then shared that in throughout the network of canvassers. Those stories would be elevated to a radio campaign, a television ad, that they drew from those conversations. And that was all, not all, but it was often facilitated by technology. People could shoot a little video interview on their smartphone, and then that could be communicated throughout the network. So those sort of one-to-one, those human connections can then be amplified through technology. So I totally agree.
Well, I want to thank you all for this. What you're saying is, you're talking about communication, talking about empowering an individual. I love how we spoke about how it, and Ray, you brought this up, how you have to let people know how it affects them. We are driven by personal interests. We're also driven by the amount of effort something takes. And it's really hard to do this work. It's really hard whether you're in recovery, it's really hard whether you're a family member, it's really hard whether you're advocating for something. You have to be persistent. And how important that is, because I think that everyone here at Mobilize Recovery is in it. And what you're all saying is we have to make this bigger. We have to make this bigger. And we have to show people why it matters to them, why it matters to their family member, why it matters to everyone. And one of the things that strikes me is everything you're all saying focuses, whether it's supporting recovery of helping someone realize what's possible in a recovery system of care, in a technology-based system where there's reach, there's access, you can come in, some of the concerns around it. But what I've heard is about salience. It's making that part of someone's life. It's technology can do that. And we think about salience because we can also personalize. You know, Brenda, and David, you've talked about this level of personalization, which makes someone feel it. And it makes someone feel that it's about them. And the role we have, whether we're building interventions for individuals in recovery, or we're advocating, or we're mobilizing, or whatever we're doing, is this opportunity to make sure people understand how important this is to them, how important this is to their community, and doing it in a way that we can make it salient and personalized to them is crucial, and the opportunity with technology. So thank you all so much for being here, and thank you to everyone at the Mobilize conference.
Thanks, everybody.
Thanks, everyone.
Thanks so much, everybody.
Hello and welcome. My name is Bill Smith, and I'm excited to be hosting today's conversation about what it takes to build a strong social movement. We have a couple of fantastic guests today, and we'll be sharing with you some lessons on developing social movements and